Ladies and gentlemen, this is a story that came out November 13th, 2018 from CNN. Parents accuse CDC of not reporting children's deaths from polio like AFM. They are saying these kids are dying. Many of them are dying. And the CDC is purposely not recording the deaths of all of these children. Let's get into it. Parents of children who had a horrifying polio-like illness are accusing the Center for Disease Control for hiding the deaths of two children who suffered from the condition. The parents say by not publicly acknowledging the two deaths, the agency is intentionally downplaying the severity of acute flaccid mellitus, AFM, a disease that paralyzes healthy children in a matter of hours. It's like they're just sugarcoating this, said Katie Bustamante, whose son Alex, 6, died in May. It eliminates my trust in the CDC. The accusations come amid a wave of criticism from parents of children with AFM and from some of the CDC's own medical advisors. In a recent on-camera interview with CNN, a group of parents gave the agency an F for its handling of the outbreak. A CDC official said while she couldn't comment directly on the boys' cases, there may be a lag in AFM reporting from physicians to health departments to the CDC. I think we want to catch up with the backlog, said Dr. Ann Schuchat, Principal Deputy Director of the CDC, a 30-year veteran of the CDC and a retired Rear Admiral in the U.S. Public Health Service. Even the past week, we've expanded the number of disease detectives on the program. Schuchat, who twice served as acting director. See, I don't like when they do this. When they drop the ball, what they try to do is go to a person's credentials. You will notice this in business a lot, ladies and gentlemen, because they can't fight against what these parents are raising. So they're going to, oh, so-and-so been here for 30 years. They have this track record. Oh, they've been a director and they've been in charge of this. That's what they do. You're going to find that they do this all across the board in business when they have no explanation for what they've done or what they have failed to do. And it does not meet what these parents are saying. So I'm just going to go over, her credentials and what they're trying to prop up about this woman because it's completely irrelevant. I certainly want to make sure information that we have is shared as quickly as possible, Schuchat said. We wish we understood all that we need to about this disease and how to best diagnose it, how to treat it, and how to give family enough information about what to expect. I think it's very challenging when your child has been through something quite traumatic to not even know what the prognosis is. She added that there's no simple lab tests for AFM, so CDC disease detectives have to carefully review medical records. 26 states have confirmed cases of AFM and 11 additional states have possible cases, according to a survey last week by CNN of state health departments. This year, there has been 80 confirmed cases of the illness, and 219 cases are currently under investigation, according to the most recent CDC data. On its AFM surveillance page, the CDC doesn't mention any deaths from AFM. At a press briefing last month, Dr. Nancy Messonnier, director of the CDC's National Center of Immunization and Respiratory Diseases, mentioned the agency knew of one death in 2017. Well, they're talking about a death. This woman's son died in May of this year. And so they didn't even mention that. Chris and Robin Roberts lost their 5-year-old son, Carter, in September after a 2-year battle with AFM. CNN has seen portions of Carter's and Alex's medical records, which shows their doctors had diagnosed them with AFM. In Carter's case, doctors at 3 medical centers, Virginia Commonwealth University, Johns Hopkins, and Boston Children's Hospital, diagnosed him with the disease. The CDC has set up a system where physicians report cases of AFM to their state health departments, which in turn report the cases to the CDC. 2 pediatric neurologists who served as medical advisors to the CDC on AFM said they think the agency could be faster in reviewing and reporting cases and deaths. It shouldn't be taking this long to confirm these cases, said Dr. Keith Van Horen, assistant professor of neurology at the Stanford University School of Medicine and one of the CDC's advisors. That kind of turnaround time for mortality reviews is a symptom of a disconnect at the CDC. So even these doctors are pointing fingers at the CDC and saying, you are the problem. Carter's parents agree. They're doing a shit job, that's what they're saying, of measuring this, excuse my French, said his mother, Robin, a healthcare IT specialist. Carter Roberts. So this is the child that died this year. Mommy, help me. On July 29, 2016, Carter vomited after dinner. The next day, he had a fever of 99 degrees, but was feeling well enough to eat and drink. It's just a virus, thought his parents, who have 2 older children. It was nothing alarming. The next morning, Robin went into her son's room and found him on the floor. Mommy, help me. His mother remembers him saying. Robin remembers trying to help Carter stand up. His head flopped back. He couldn't use his arms. So he couldn't use his right arm. She scooped her son up and took him to the emergency room. Within a few days, Carter couldn't move anything below his neck. He was put on a ventilator, so he couldn't even breathe on his own if he had to be put on a ventilator, and never came off. For the next 2 years, his family and nurses did everything for him. They fed him. They scratched his nose when he had an itch. All day and all night, they turned him every 90 minutes so he wouldn't get bed sores. Carter was undeterred by his illness. All right, so for 2 years, they cared for him. And on September 22nd, he was having trouble breathing, so that's this year. Robin was home alone with him and called an ambulance. His last words were, "Mommy, I'm fine." All right. So today, Carter's ashes sit in an urn in his family's living room. So this is their son that died this year. A doctor wants answers. Both Carter parents and Alex parents say they're not sure if the CDC ever accepted their sons as official AFM cases back when they got sick in 2016. Alex's mother says the doctor told her he reported his death to the California Department of Public Health, but she doesn't know what happened after that. In Carter's case, his neurologist, Dr. Sanjay Rao, told CNN he filled out paperwork on the CDC's website and, following the CDC's instruction, sent the paperwork, lab specimen, and MRI findings to the Virginia Department of Health. The epidemiologist there confirmed Carter's information was sent along with the CDC, according to Rao, assistant professor of pediatric neurology at Children's Hospital of Richmond, Virginia, Commonwealth University. Doctors and parents say that their frustration is that when they've asked the CDC about cases and deaths, they haven't received responses. So they're trying to stay silent on how many of these kids are dying. And ladies and gentlemen, you can best believe it's more than some 1 in 2017 and 2 this year. It's way more than that. They just don't want to tell the public. His voice chokes with emotion as he talks about Carter, whom he cared for more than 2 years. I want to know the process benefits future cases of children with AFM, he said. Other experts agree with Rhea. We want accurate numbers, said Dr. Keith Tyler, professor and chair of the Department of Neurology at the University of Colorado School of Medicine and an advisor to the CDC on AFM. An accurate count could help answer questions, he said. Where are the cases? How old are the patients? Are they male or female? That helps us understand causation, he said. The CDC is in the place of trying to understand the long-term consensus, and a death is really important, added Van Haren. The pediatric neurologist, let me just go down, Shuchat, said the CDC is working hard on AFM. We are working 24/7 on this and really take this seriously, she said. It sounds to me like they probably are understaffed out in the field. You got all of these cases cropping up every day around the country, and I don't think they have enough foot soldiers on the ground in these different states. And all of their information is lagging, and I really do think they are hiding these deaths. They know the deaths are there, and I bet you there have been deaths since these AFM cases have been coming up among these children, and it's not being reported, just like these parents are saying. The CDC spokeswoman said in the past 2 weeks, the agency has added 14 officers from the epidemiology intelligence services, known as disease detectives, to help review AFM reports filled by state health departments. And this is the other child that died. His name is Alex Bustamante, 5 years old. Had a headache, and then the next day developed paralysis. He died May of this year. So this child died in September of this year, and this one died in May of this year. So you have two that died in 2018, and they're saying that the CDC didn't even reveal that these two died. So you have to wonder how many more died that no one knows about. Okay. On June 10th, 2017, about 10 months after Carter got sick, Robin reached out to the CDC. She was angry. I know it may seem menial, a request from a clinical educated mother, but you are doing these kids and families a disservice to not further educate physicians or demand surveillance similar to that of Zika, she wrote in an email she found on the CDC website. Please do what is right by public health standards and gather more information. So she's telling them they need to do more. And she is saying her son was immunized, you know, because, every time flus or anything happens in this country, the first thing they try to say is these are people that are not immunized. And this woman is saying her son was immunized. He was. So he had all of his vaccines. So they can't use that excuse on this child. Carter. We observed very good hygiene precautions and still became a vent-dependent quadriplegic overnight. She received a response 2 days later. We are sorry to hear about your son. It said, your comments have been forwarded to the appropriate CDC program for their information. They will contact you directly if they have any questions. She never heard from the CDC again. Yeah, I think it's pretty obvious that, shoe chat here is a little shifty. Okay, I'm going to go down a little bit. Last week, another enterprising parent got a response from the federal agency. 4-year-old Joey Wilcox of Herndon, Virginia, was diagnosed with AFM in September. His father, Jeremy, works with government agencies as part of his job at a high-tech consulting firm. Wilcox knows how to seek out and find officials. He aimed high. Online, he found Shuchat's email address and asked her to meet with him and other parents. He says she responded within 15 minutes. He thinks one of the reasons for the quick response is the F that parents gave the CDC. That was a pivotal moment, he said, of the CNN story. More than a dozen families are scheduled to meet with Shuchat Tuesday in Washington. Carter Roberts and Alex Bustamante, parents, will be among them. So this is another child, Joey Wilcox, that has the same thing. He has AFM. So am I surprised the CDC is covering these deaths up of these children? No, I'm not surprised. I'm not surprised. Just like I'm not surprised that they keep downplaying the opioid deaths in this country and trying to lowball them, trying to make us believe that a drug addiction that has gone on for over 20 years is only yielding 115 deaths a day. I mean, these CDC people must think somebody is dumb as hell. But please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I will see you on the next video. Peace, family.